Coming up today, two complex conditions, one destination. When Lon and Don Wade faced a failing heart and an incurable liver disease, the University of Kansas health system became the place equipped to handle both. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Lon and Don Wade did what many middle-aged couples do. They prepared for the unexpected. They wanted to get their life insurance policies in order. But with that process comes tests and screenings. What they did not know was that one routine exam would set in motion a serious health battle for both of them, and a journey that would test their marriage and ultimately bring them closer than ever.
We can go look at the plants outside.
Yeah.
Don and Lon Wade have been together for nearly 3 decades.
We met at Lee Aerospace. We worked together, started going out a little bit, and pretty much got attached.
He had invited me out to see one of his shows because he is a musician.
They've taken care of each other the way spouses do. But it was a routine life insurance workup that put their commitment to the true test.
We both applied for life insurance, and ironically, he passed the physical and I did not. My liver enzymes were up off the charts. They were excessively high. I had no idea what was going on.
While Dawn was trying to figure out her liver issues, Lon started dealing with bouts of GERD, swollen feet, and was having trouble breathing.
I kind of felt a burning sensation in my chest. I thought maybe I had an ulcer or something, so another day went by and I noticed I was getting weak and I was having troubles walking.
They had hoped some healthy lifestyle changes would help, but it didn't help Lon. Doctors delivered some startling news.
That's when he told me that I needed a heart transplant, because a doctor here knew something was going on that he couldn't fix. So it was like, you need a specialist.
Lon would need a heart transplant. His doctors referred him to the University of Kansas health system, where Lon underwent a successful heart transplant surgery.
You're doing so good.
But while Lon was recovering, Dawn, who was also referred to the health system, found out that she had a rare disorder called HHT. It affects the blood vessels and causes them to become fragile and bleed easily. It's complicated because there's no treatment for HHT. So her hepatologist, Dr. Ryan Taylor, is monitoring Dawn, keeping a watchful eye on her health.
I do have liver cirrhosis. I do have some damage. That part is never going to heal. That's hard to deal with, and you're reminded of it every time you have a telehealth or every time you're sitting in front of them, that there is a possibility that the liver could still deteriorate on its own.
Meaning a liver transplant could be in Dawn's future.
This is my world.
But for now, this couple is taking care of each other and maintaining positive changes.
He probably won't tell you he's got a green thumb, but he does.
Now we're really watching each other and paying attention to anything that we think might be wrong, because now we know what to look for.
We are focused on, how do we take care of the family? So it drove us to eat better. It drove us to be better.
And we are so glad that Lon and Don came all the way from Wichita, Kansas to be with us this morning. So good to see both of you.
Good morning.
You look great. How are you feeling today?
Good.
Great.
Good.
Absolutely great.
And you're here with Dr. Ryan Taylor.
Yes.
Always glad to have him. He's a hepatologist and the director of the liver transplant program. Good to see you.
Good morning.
Good morning. And joining us virtually is transplant cardiologist Dr. Hirak Shah. Dr. Shah, good morning.
Morning. Good to see you guys. Sorry I couldn't be there in person.
I know, we're sorry you couldn't, but we're glad you're here anyway. So thank you for being with us. Don, I want to start with you. I want to start with you because this started with this basic health insurance screening. You were doing all the right things.
Yes.
What surprised you most when you got these results?
That I really did not know what was going on. I didn't feel terrible. I didn't feel awful. A little overweight. Just normal activities, normal life. And how could I have anything going wrong?
How could you have anything going wrong with
Yes.
you? Yeah, life was going good. Who started feeling sick first?
Lonnie.
So, Lon, what were you feeling like up until when you got these tests going? Were you
Everything
feeling
was,
anything?
I felt normal, but just out of the blue, I really got, like I said, a burning sensation. I thought maybe it was an ulcer. And I started feeling really bad a couple days later, and I knew something wasn't right. So I went in to the doctor, and they did tests and labs and all that. And they said that it wasn't good.
Wasn't good.
I had to come back and do more testing, and finally they said I needed a heart transplant.
But smart that you were listening to your body, because a lot of people would have just thought maybe there was just
Yeah.
something going on, it would have gone away.
Yeah.
But you went in to get checked, so that's really
Yeah,
good.
I knew it was bad.
Knew it was bad.
Yeah.
Dr. Shaw, is that pretty normal, somebody to maybe brush off something like that, some type of burning sensation in their chest like that?
Yeah, I mean, everyone presents a little bit differently, and that's kind of one of the hardest parts, is that sometimes it could be as benign as chest burning that you associate with GERD, but underneath it could be, something related to the heart. And so everyone presents differently. What I've found is the patients that, are relatively healthy, and have a one organ problem, which in this situation was the heart, usually present a little bit later just because the rest of the body is able to compensate. And so I think that's kind of what ended up happening, is that things were able to be mitigated until things kind of met at the road. And I think that's probably what happened. And things escalated pretty quickly.
That makes a lot of sense. So it's hard enough one person in the home is dealing with a major heart issue, but now you have both of you doing this. How are you just coping with life? You've got work, you've got a big family to take care of. How did you do it?
Well, we've always been hard workers. We just kind of took the bull by the horns, if you will, and just looked at our situation. What do we need to do? We started gathering information, started, how do we balance? We've always been very good at balancing life. Okay, we have this issue, what are we doing? I have to work this time, we have to pick up this person, and it just became another item that we added to our things to balance.
Well, it helps that you two, I think, have a pretty special relationship.
Yes,
I
we
think
do.
that's very obvious when I first met you this morning. Dr. Taylor, explain Don's rare disease, and I have to tell you, I call it HHT because there is zero chance of me pronouncing this. I cannot pronounce it. I will not even try. So I'm going to make you do it on this Monday morning.
Yes, perfect. Yes, so hereditary hemorrhagic telangiectasia is a rare liver disease where you get these collection of blood vessels. Can get them in your liver, can get them really anywhere in the body, and can cause bleeding problems is really the main thing. But over time, it can also cause abnormal connections and make your heart work harder and cause other effects on the body. So it actually can have some things that we don't see every day. So it's a rare thing.
Rare, and there's no direct treatment.
There are some treatments, but really there's nothing that's really the go-to. So we try to respond to any of these new blood vessels that pop up, or if there's bleeding, we can treat, but there's not like a preventative medicine or things like that right now.
So, Lon, when all this was just starting with Dawn, so you started feeling sick. So you started feeling sick, but then talk us kind of through your diagnosis, though, of this heart, because you guys are kind of going back, kind of ping-ponging back and forth. One's not feeling well, and then you're getting this diagnosis at the same time that she's finding out her enzymes are out of whack.
Well, I kind of put my feelings aside, and I was more focused on her because I kind of knew what I was getting involved with, but we didn't know anything about what she was going to go through. So it was a lot. It was a process. So, but we stayed positive and got through it. And
so when you went in,
everything
you
worked out.
said you heard out pretty quickly that you would need this heart transplant.
Mm-hmm.
What was that news like? That's a lot to say. I have some pain going on here. You go into your doctor, you're thinking,
Yeah.
okay, they're going to hopefully figure out what's going on. And now we've jumped all the way to needing a heart transplant. How did you handle that?
It was shocking at first, but like Dawn said, we just kind of, all of our problems, we spent about 5 minutes thinking about it, and then we go, how do we solve this now? Mm-hmm. So it was life-changing. I knew I wasn't going to be the same after that. There was no way. So I did a lot of changing, and we went forward, and here I am today.
Here you are today.
Yeah.
We like that.
Yes.
We like that. Dr. Shaw, explain what kind of care is needed for someone after a heart transplant, the care that they need when they get back home. I mean, your hope is that you have a spouse or a caretaker that's, in tip-top shape. That wasn't the case, with Lon and Don.
Yeah, and there's probably multiple facets to the post transplant care. Immediately you're dealing with open heart surgery. So you have a big open, scar that obviously is working on healing. And so many things that we take for granted, showering, driving, lifting weights, there are restrictions, especially in that first, 10 to 12 weeks where that sternum's healing. And so that's why having, a support person, someone to, drive to appointments, do some of the basics that aren't able to be done is very, very important. Also in the very beginning, we have a lot of visits because that's probably the highest risk time for many complications, including rejection of the new heart, infection because of all the medicines that are required to keep that heart from rejecting. And so there's frequent visits, and living from Wichita, that's many trips to Kansas City, which, as we all know, is not the easiest drive. It's 3 to 4 hours, and so that beginning is really a lot of visits, a lot of labs, and then biopsies to make sure that the heart is still not having any rejection. And so those first 3 months are intensive, and having a core person near you is probably essential to having success to this operation.
Dr. Shaw, you touched on it. That was my next question. How common is it to have patients come from out of town for a heart transplant?
Yeah, so every program is going to be a little bit different depending on where they are geographically. And I would say here at the University of Kansas, it's a unique situation. We're at the very, east side of this state, and we're the only transplant center in the entire state. And so we get many patients actually from Wichita, and actually Wichita is kind of in the middle of the state, so they get a lot of patients from even western Kansas. And so many patients come, 3 to 6 hours away because we're the only center in Kansas that are able to offer these therapies. And so what we're trying to do is trying to make it a little bit easier, for patients. And I think our technology has gotten better where we're able to manage these patients far away. There's blood tests that we can do for surveillance. There's telemedicine that we can do. But in the end, there are still visits that are required at the main campus in Kansas City. But I would say, if I look at the transplant program, we would probably have 50% of patients outside of the Kansas City area. So very common. And I think just because of our geographic location.
Sure. Dr. Taylor, same question. How often do we get liver patients with advanced liver disease, and especially now that we have the Living Liver program?
Yes, yeah, exactly. Same situation. We're the only liver transplant program in the entire state, so patients will come throughout the state and from western Missouri. So we do see a large patients travel to come see us. With the advent of telemedicine, that's really been a very big help for us. A lot of bad things came from the pandemic, but telemedicine has helped us connect with our patients that are far away.
Lon, you go through this organ transplant, knowing that your wife might have to have a liver transplant down the road, certainly not for sure. Are you prepared? How do you prepare? Is that something you think about?
Well, I was caught off guard at first, but we had went through something kind of like this with her aunt. So we were kind of familiar with, the process of what it's going to take for her to get into the hospital and certain procedures. So I wasn't fully prepared, but I kind of knew what was going on. So it helped me a lot to go forward with her and thinking about what I need to do for her next. So.
Sure. And Dawn, just kind of as a caregiver, as a spouse, what would you say to people who think that maybe traveling out of their area for transplant care of their loved one, or this high-level liver care that you're needing isn't an option, or maybe too complicated, that might keep them close to home, but maybe they need that higher level of care? What do you say to them about trusting to move forward?
I would say get in the car and go. It's worth it, especially here at KU. We cannot say enough excellent, great things about this program here. Aside from not living here, we don't mind getting in the car to travel just because we want to have healthy lives. We don't want to go down a path that we're not healthy, and we don't want to end up someplace that we don't want to be. I mean, we're very healthy, happy people, and we want to keep living long lives. We have children. We want to watch them grow up, and we want to have grandchildren someday too. So.
You want to stick around.
Yes.
You got a lot of life to live. Lon, we have a really special video that we want to share with our viewers. This is the moment that you got the chance to listen to your new heart for the very first time.
Good heart.
Wow.
Yeah.
It's pretty neat.
Dawn, do you want to listen?
Yes.
You ready? Okay. What was that moment like?
It's kind of hard to describe, really, because it's
bet.
like I knew it wasn't my heart; it was somebody else's heart, you know. So it was pretty shocking at first, knowing that I got a second chance, you know, and it's now I got to take care of this heart.
Yeah.
So it was pretty amazing, really, you know. I mean, the technology that the medical community has now, it's pretty amazing.
Yes.
I mean, I'm sorry. go ahead.
No, thank you for sharing that moment
Yeah,
with us.
yeah.
I mean,
It
something
was-
you don't get to see every day, and
No.
that's a real a beautiful moment. Dawn, as a caregiver and now a patient yourself, how is the healthcare team, your healthcare team, how are they working to support you as you continue to move forward with your issues?
We are in constant communication. If I have any questions, I don't hesitate to reach out. I'm always trying to learn everything that I can, so I'm asking the right questions. If I don't have the right question, then asking them leads me to it. I think that we have a great relationship, Dr. Taylor and I, for sure. And then I have, you know, a great Wichita gastrologist that also supported this as well. And Dr. Zaya has been amazing. He's the one that referred me, and more than happy with all of my health care people.
Lon, I want to ask you something, because after your diagnosis, I understand that you learned several of your family members had heart problems. Several of them died from their conditions.
Yep.
How would knowing this beforehand possibly have changed things for you, do you think?
It would have changed my direction and life choices and stuff like that, and it was shocking finding that out. And I can't believe I made it this far, because they were all fairly young, and not knowing that, you know, because I had 5 of them pass away, I had no knowledge of it at all. So I got lucky.
Yeah, you
And,
did.
Yeah.
Dr. Shaw, how important is that? Just, I mean, it seems like an obvious question, knowing your family history, knowing your heart history, asking those questions, but not everybody has, you know, has that knowledge.
Yeah, I think it's incredibly important. I think more and more we're learning that genetics are a huge part of heart disease, especially in patients who are younger and don't have blocked arteries. And so talking to the family, about diagnoses is important, because then you can screen patients earlier. You know, usually if someone has a genetic cardiomyopathy, you know, we do gene testing, we get echocardiograms every so often, even if the patients have a normal heart, because we know it can develop in time, but they're kind of in a different surveillance program if we know the family history. And so I think if there's anyone out there who knows they have a family history of heart disease, that's when you need to talk to your primary care doctor to say, hey, maybe I need to talk to a cardiologist, or, you know, get some sort of screening, EKG, echo at regular intervals to make sure that things remain relatively stable.
Sure, yeah, the screening, the surveillance on the clinical side, but then the part that you can control is your lifestyle. And that's what Dr. Taylor, really, that's what stood out to you. You said you got to meet Lon and Dawn,
Yes.
because you said what's really great about their story is just all the lifestyle changes they were really willing to do to get back on track. Tell us what you've been doing to make those changes and set things in into a good motion.
Well, the first thing we did was looked at what we're eating, and we were not the greatest eaters. I'm not going to say we were terrible eaters, but sorry. We tried to figure out what the first and best diet is for both of us, and you know, that fell into kind of the Mediterranean type diet, where you're eating more whole grains, you know, fruits, vegetables. We're more along the outsides of the store than we are in the inside of the store. And then I have a second job where I am walking a lot. So over the course of the 2.5 years, I've lost 100 pounds, and you know, Lon is also fit, and we just keep moving. We stay upright, we're exercising, we travel now more, and eating so much better.
Dr. Taylor's shaking his head with a big smile on his face.
Yes.
That's got to make you
Yes.
happy, because there's only so much you could do. Then when they go home, they've got to do a lot of the work.
Yes.
Yes.
Dawn's very humble, but she's one of the most motivated people I've met, and just been so impressed by her positive energy. Every time I've seen her, she's just doing better and better, and just wanting to keep working towards close to perfection as you can get with your health. And just very inspiring, honestly.
Lon, have you been excited about these changes?
Yeah, I'll just to get back to the road trip, we'll use that opportunity to talk about the past, present, and the future. So we look forward to the road trips coming up here. So it's our quiet time, and we get to talk, and there's a lot to talk about, obviously. So
And when we're traveling now, we don't stop and eat at all the places. We actually grab food and pack it and take it, and then we have food along the way as well.
And I love that you're doing it together.
Yes.
Doesn't sound like anybody's resisting.
Right.
No.
There's one common goal in
Even
mind.
this trip is a great trip, because it's like, oh, when are we going to Kansas City again? Okay, good.
You better have packed something healthy to come see Dr. Shaw and Dr. Taylor.
Yes.
Good. All right, well, be sure to ask your questions. Use the chat on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Dr. Shaw, back to those screenings, because Lon passed that basic screening, but his heart was failing so much that he needed that heart transplant. He learned that very quickly. Could you kind of fill in the gaps of how that progressed? You know, I think you had mentioned, you know, that kind of there was a compensation of other healthy parts of the body, but kind of go over that again. That's really interesting.
Yeah, so I think, you know, in his case, I think he, you know, his heart transplant was in March, and I think the first time, and you can correct me if I'm wrong, Lon, is that he met our team. He met Dr. Vidich, who was our previous transplant director, I think just a month prior. And, you know, when you look at his heart was very, you know, large. It was dilated. The ejection fraction was low. And we run through serial testing to see kind of, you know, patients can feel bad, but then we kind of do some testing, you know, objectively to make sure how bad is his heart. And a lot of it requires something called a right heart catheterization, where we put a catheter directly inside the heart, and we actually know exactly what the heart's doing at that time. We know how much fluid is in the heart. We know how much that heart's pumping in terms of liters per minute. It's a very, very good test that gives us a sense of how far this heart is in terms of its progression and its disease. And what we found was that for him, his numbers were abnormal. He had elevated fluid pressures, he had low cardiac index, and he was started on a medicine to help his heart pump a little bit better, which is an IV medicine. And that allowed us to bridge him to getting an eventual heart transplant, which I believe happened about a month after we evaluated him. So he actually progressed pretty quickly in terms of, you know, when we evaluated him to when we transplanted him. And I believe he's getting close to, you know, 3 years out, and he looks really, really good right now. That's great.
Well, we want to show some video of a heart transplant procedure. This is not your surgery, we want to mention. But when you found out you need a heart, that call came so quickly. You know, you're just kind of thrown into trying to process the information of needing a heart, and now you're getting one.
Right.
How'd you handle that?
Panic. Yeah. I thought I would be ready, but my wife was at a wedding, and I got the call, and she immediately left the wedding, and we packed as much as we thought we needed, and 3 hours later we're here.
We're here.
Yeah, we didn't mess around with, you know, waiting or thinking anything other than we need to get here now. So.
Don, how important was it that you were both able to be treated here, you know, both needing a higher level of care, both being able to treat it at the same facility here at the health system?
It was beyond important. Because Lon had went through the transplant, we had already trusted this entire organization. So as soon as I find out that I potentially have an HHT type liver, you know, I was like, oh, I need to get up there, because they're the top in my opinion, the nation. But you know, let's go find out what they have to say, and then we're already in, just in case I do potentially need some type of, you know, further medical need.
Dr. Shaw, how does access to advanced testing and subspecialists really change outcomes for patients?
Yeah, I'm going to be biased because we are the Advanced Heart Failure Center at the University of Kansas. But what I would say is it's not really the physicians are important, but we're just one part of this machine, which is the entire team. And I think the Wades can speak to that. There's, we have a coordinator, we have a social worker, we have a finance person, we have a surgeon, we have a palliative care specialist, we have a dietitian. There's a huge team that goes into taking care of a disease that does involve one organ, but that one organ impacts the entire body. And so I think what defines an advanced center is having all the resources and all those team members that have a different way to approach different conditions, I think is really, really essential. And I think getting evaluated by that center, we will do a thorough assessment. We will make sure that if that organ is failing, that we will do whatever it takes to see what we can do to help. And I think that's what defines what we're able to do at Kansas. And it really is the team that is a part at this hospital that really, I think, allows us to, be proud of the outcomes that we can deliver to patients.
Dr. Taylor, what are some best ways, some best advice you have for our liver health?
I think it's obviously getting regular checkups is a big thing. In contrast to heart disease, where you may have some symptoms, most patients with liver disease really don't have a lot of symptoms, so it's those blood tests that we rely on, and that becomes very important. So getting your regular physicals, if something's abnormal, following up on it, and asking questions, looking at your reports, being an engaged patient. Dawn is an excellent example of that. She's calling us as soon as she gets a result because she's there looking at it, processing it, and being able to be engaged in your own healthcare is going to help you have the best chance of success.
Does liver health get misdiagnosed or overlooked, or do people overlook it for something else?
I think there's been, one of the most common diseases we see is fatty liver disease, which we've talked about a lot, and I think a lot of history has kind of had people kind of take a lesser approach to that, and we've now learned more about it, that is a significant finding if you have fatty liver. And so getting people in, seeing the right people, getting the right tests, so then we can get an idea of how significant it is, becomes very critical.
All right, Dr. Shaw, same question. It's February, it's Heart Health Month. What is your best heart advice?
Yeah, I think for me it's obviously going to see your doctor, but also just staying active. I think there's a huge benefit to cardiovascular exercise, and it doesn't have to be intense. 30 minutes of walking 5 days a week, doing a little bit of resistance exercise and just being active and trying to just move, I think makes a huge, huge difference. So when the body is getting stronger, usually all the organs usually respond to that very, very well. And then also at the same time, just get your annual physical. With that comes, listen to your heart to make sure there's no new murmurs, blood test to make sure that your cholesterol is doing okay, and then a chance to see your doctors and say, hey, maybe I had that symptom, those heart palpitations, because then there's always tests, that we can do to make sure that everything's going okay. So staying active and seeing your doctor at least once a year, I think will help prevent things from getting too far off the curve if something were to happen.
I think you both have kind of answered this question. I'm going to ask you, but how has this most strengthened you both as a couple, this experience?
Oh, gosh. I would say it brought us very close together. For years, we've work mode, and just surviving, raise the kids, do what you can, and then you're always in a hurry. And now we're not so much in a hurry, even though we're hurrying at it, but anytime we have an opportunity to do something, go somewhere, we're planning vacations. They might be driving right now, maybe flying later, but every opportunity that we get a chance to be together, we have enjoyed it. And
Lon, are you taking things a little easier now?
Yeah, but we have 2 bucket lists now.
Oh, 2 bucket lists.
Yeah,
Okay, that's so you're busy, but taking it easy.
Right.
What's a big bucket list for you?
Oh, I think, seeing everything in the United States one time at least, and we're kind of checking those marks. So we're, like the doctors told me, it's like when you're feeling better, live your life. Yeah. That's important.
Get after it.
Yes. Yeah, you got to get out there.
Let's get to, got a couple questions from viewers this morning. First one is from Jean. How hard was it to get a matching heart for the transplant, and how hard is it to match livers? So question for you, Dr. Shaw, how hard is it to get a matching heart for a transplant?
Yeah, it depends on the individual person. So there are a few factors that kind of show either make it easier or harder to find the matching heart. Obviously, size is one of them. You want to make sure you find a heart that's similar size of the recipient. Even though my heart is okay, my heart would not be good for an NBA player. That's just the reality. Blood groups also important because you want to match donors with compatible recipients based on blood group, and so certain blood groups are more favorable to having shorter wait times than others. And then how many antibodies that you have, to your two potential donors. Sometimes if someone's had a lot of blood transfusions or have had prior surgery, or if they're female, if they've had multiple pregnancies, they might develop antibodies to potential organs that are out there. And so those are kind of factors that kind of play into how long we have on the waiting list. And so it depends. If you have someone who's relatively small that has a favorable blood group that has no antibodies, we should be able to transplant that patient pretty quickly. If you take it on the other end, they might be waiting a long time. So it differs by patient.
Dr. Taylor, what are the matching factors for livers? Similar?
It's very similar. It's really only your blood type and your size. That's it. So the liver is much simpler when it comes to matching, and those we don't really worry about the antibodies too much.
All right. Jeremy has a question for you, Dr. Taylor. With the extra blood vessels forming an HHT, does the blood going to extra places mess with things typically in the blood, like iron levels?
Certainly, if you have the bleeding, you can deplete your iron, and so a lot of patients can deal with anemia and have that trouble with this condition, and also impacts other organs like the heart pump, because now the heart may have to work harder because of it.
All right, I want to get our takeaways today. Dr. Shah, what do you want people to really take away from this conversation?
Well, thanks for having me. I think the Wades, what strikes me the most is their mental fortitude. They, dealt with things that, not many couples have to deal with, and they just took it in stride and they kind of owned it, and they, just looked forward and never really, looked in the past, and they, keep fighting and keep doing it. And I think that's why we see them today. And, especially with Lonnie, he's done very well after his heart transplant. And I think a lot of that comes down to just how your mentality is. How do you approach life? And I think if you approach life the way they're approaching life, many things can get solved.
Dr. Shah, great to have you. We appreciate your insight always. Thank you.
Of course. Thank you, guys.
All right, Lon, what's the big takeaway from your story? What do you want people to know?
I think it's important to get checked regularly and listen to your doctor. They're the experts, and do what they ask, and you'll come out on top. There's no doubt about it. So,
Dawn, same question. What's the takeaway today?
Sorry. Definitely get checked out. More physicals. Every year you get a free physical. I think that's really important. Do it. Check your blood levels while you're doing that. And stay positive and always be trying to understand what you're dealing with, not be afraid of it.
Well, thank you both for sharing your health story, your love story. Yes. We really appreciate it. Dr. Taylor, what's the big takeaway today?
I mean, we've obviously talked about screening. That's an important thing. I just really like how engaged they are in their healthcare. I won't say they're excited to come to Kansas City, but they always look at it as a positive because they know that, they're working towards their health and longevity, and so they don't see it as a burden to come here, but really as an opportunity to have the best life that they can. And so I really encourage patients to, use their positive energy and being involved, ask questions. Healthcare providers want to give the best care that they can, and we're not mind readers. And so when we have people ask those questions, that really helps us make sure we're on the same page of how we can best care for the patient.
Dr. Taylor, thanks. Always
You're
good
welcome.
to see you.
Thank you.
Thanks to all of our guests. Thanks to our viewers for being with us today. Coming up tomorrow on All Things Brain Health.
He said something to me first, like, hey, are you okay? And then immediately said, hey, we need to get him some help.
Michael McHugh was in the middle of conducting a job interview when he froze and began slurring his words. He was having a stroke. Luckily for Michael, that job candidate knew exactly what to do.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.